We begin with a crisis that is killing our kids, and adults for that matter. Opioids are making headlines and campaign ads for a number of reasons right now, and honestly, none of them are good. Most have to do with the fight against the opioid crisis. Just recently, sheriff's deputies in Clay County found 1.5 pounds of powdered fentanyl in a man's car. That's a drug that's 100 times more potent than morphine. 2 milligrams can be deadly. What deputies found was more than 340,000 times that.
It's really becoming a problem. We're seeing it a lot mixed in with meth, heroin, cocaine. So it's being utilized in other drugs as well. And it's all just to get people addicted to it so they come back and buy more.
Law enforcement officers are also seeing fentanyl mixed in with counterfeit prescription pills, meaning many more people are taking it without knowing. This isn't an issue solely affecting people living with addiction. Here at home, we've lost teenagers who thought they were taking pain pills. The numbers are slowing a bit when it comes to deaths, but they are still very high. In Kansas last year, provisional data from the CDC shows 1 in 69 deaths involved opioid overdoses. State Health Department numbers in Missouri show 1 in 47 deaths. Opioids killed well more than 1,000 people there in 2023. It's why there's a national focus not on just preventing drug use, but reversing those overdoses. We've discussed the drug naloxone before here on the broadcast, also sold as Narcan. It's a nasal spray that's harmless to you and me, but can bring someone who's overdosing on opioids back from the brink of death. Thanks to new rules, you can buy it over the counter now. And earlier this year, the White House launched a program designed to make sure people have it on hand and know how to use it. So when that time comes, you're able to help someone in need.
One of the things we can do is make sure that naloxone or Narcan is available to every individual who's overdosing, because fentanyl is still killing too many Americans.
Federal government's calling on organizations and employers to have Narcan at the ready and supply training for workers. We've even seen some states like Kansas set up naloxone vending machines at libraries or even in places like turnpikes, casinos, outside fire stations, that sort of thing. Leaders in cities here in the metro, too, are working to make Narcan more accessible. Health Department staffers in Independence, Missouri went around to libraries around town last month, handing out doses of the life-saving drug to people who wanted it. City's given away far more than 1,000 doses now since March of last year. Here to get to the heart of the matter, please welcome Christina Heinen, Director of the Independence Health Department. Thank you so much for being here.
Thank you so much for having me.
Oh, our pleasure. First off, how was interest in the program last month? Is there a demand for naloxone in our community?
There absolutely is a demand in our community, and our community has been great about coming out, very supportive. We gave away during those events 151 boxes of Narcan to our community.
And this is something that people can just have on hand just in case, too.
Yes, it is shelf stable, so you don't have to worry about refrigerating it. You can have it in your backpack, in your purse, in your car, and have it there just in case you come across a family member, a friend, or just a member of our community.
That's true, because that's a good point. A lot of people say, well, I don't have a family member who is on opioids or that sort of thing, but in a Good Samaritan type situation, this could potentially save lives, right?
Absolutely. I'd like to say, first of all, we never know the struggles that some of our family members or friends are undergoing. We don't know what's going on behind those closed doors. So I want people to be open that it may be that friend that they know. It may also be that they're going out on a Saturday night and they're having fun and they come across someone who has overdosed. It may be another student in the school. In the last few years, we've seen a 26% rise in the number of overdoses among those under 17. So we know that this is a problem. So it may just be another student there at the school who overdoses. Maybe it's not a friend, but it's somebody you could save.
So not only is the demand for naloxone growing, the need for it in our community is growing as well, sadly.
Unfortunately, we have seen a rise in the number of fatal and non-fatal overdoses in the last 4 years.
Wow. How does this program work? Because just giving out a box of naloxone is one thing, but people have to know how to use it and that sort of thing.
Absolutely. All of our staff are trained in order to train others on how to use it. It's important to know that, of course, the person who's overdosing is not the person who needs to know how to use the Narcan. It's the person who's come across the scene, the Good Samaritan who's going to help out. It's incredibly easy to use. It's nasal spray, so really you just have to see that the person is not breathing, their lips are turning blue, they're not responding. You go ahead and put it up their nostril, you give a quick spray within a minute to 3 minutes. If you don't see a reaction, you can give another spray. The good news is Narcan, when it's administered, does not hurt a person. If it wasn't needed, there's no harm.
Right, this isn't methadone or something like
Correct.
that, or an alternative drug or something like that. This is something that, you know, there has been some critical pushback because I think people might not know enough about naloxone and what it does.
All it does is opioids bind to a receptor that controls whether you breathe or not. It makes it so your body no longer wants to breathe, it's no longer as concerned about breathing. Narcan is able to kick opioids off those receptors and allow your body to start breathing again. It only lasts about 30 to 45 minutes, so it's incredibly important during that time that someone calls 911 or that person gets to the ER before, just in case the drugs, the opioids that are still in the system might cause them to overdose again.
Independence has been doing this for months and months and months now.
Yes.
Have you heard any success stories of, hey, I'm glad you gave this to me because you saved my uncle's life or something like that?
We actually did. Just last year at one of our events, we handed out boxes of Narcan, gave that education. The very next morning, our firefighters responded to an overdose. A family member had administered Narcan and it ended up being one of our boxes that had saved that person's life. They had just gotten that Narcan the day before, had learned how to use it, and they saved their family member. That's not only a life saved, that's a family saved.
And a teaching moment for the community too, to say,
Absolutely.
look what can happen here.
Yes.
What's the best way for someone to get a hold of you and how can they take advantage of this program?
It's really easy. If we're at an event and you see us, we probably have the Narcan with us, even if it's not an event that's focused on opioid awareness. We still have some Narcan with us to go ahead and hand out. Otherwise, we have it here at City Hall at our health department. Monday through Friday, 8 to 5, regular business hours. You can come up to the front. It's absolutely free. The only thing we ask of our people is their zip code, just so we can track to see where it's going. Otherwise, no identifying information. We have it set up for our residents. However, we're not going to. If it's somebody from Kansas City, Lee Summit, Sugar Creek, we absolutely will give you that box.
Right, not going to turn anyone away.
No,
We get it.
never.
Christina Heinen with the Independence Health Department, thank you so much.
Thank you.
There are other resources too out here. If you live in Missouri, remember this website here on your screen, nomodeaths.com. There's an interactive map showing where you can get free naloxone. And then in Kansas, it's dccca.org and click naloxone request on the right-hand side of the page.